ECC Timeout talks are brought to you by State Farm. The James Von If Agency is here for the ECC family during these unexpected times. For more information and to get a quote, visit www.vonifinsurance.com.
Hello, everybody. Welcome back to the East Coast Conference Timeout Talks. My name is Bob Dranoff. I am Commissioner of the East Coast Conference. We're very pleased to be joined now by Dr. Brian Harper, who is the Medical Director at the New York Institute of Technology, College of Osteopathy, and also an Associate Professor at New York Tech College of Osteopathic Medicine. Dr. Harper, thank you very much for joining us today.
Oh, it's my pleasure to be here.
Hey, first of all, before we start off, I just want to, maybe you could, I'll bring you back down memory lane a little bit. You're a former college student athlete.
Yes, I did play basketball at Brown University
Okay.
just for 1 year. Then I had to move into academics a little bit more. But I enjoyed the game, absolutely. It's a good game.
Yeah. Now, where are you originally from?
I'm originally from Brooklyn, New York.
Okay.
So I went from Brooklyn, and I went to a school called Bishop Loughlin High School, which is somewhat known for basketball. I'm actually
Sure.
4 or 5 years older than Mark Jackson. He came in, he
Okay.
was a freshman when I was a freshman in college.
Well, I'm a St. John's guy, and I was the assistant AD at St. John's when Mark was playing ball there. So I knew Mark.
Okay.
I knew Mark way back when. I knew Mark, and during the
Right.
St. John's heyday.
Yeah, absolutely. So so you're familiar with Bishop Loughlin, certainly.
Oh yeah, yep. Well, we're happy you're here, and your perspective on. We're going to talk to you a little bit about athletics and where we are with COVID-19. As I was looking at your background, I know you have a strong background in preventative medicine and immunology, public health. At one time, you were the Suffolk County Commissioner of Health.
That's correct.
I'm correct. So we'd love your perspective. I mean,
absolutely.
I guess I got to ask you: have you, in your all the years as a doctor, have you ever seen anything like the situation we are in now?
Not at all, and I think that's one of the things I wanted to share. If I go back a little bit further in history, so after Brown, I went to Syracuse for medical school, and I actually started off my medical career in Harlem Hospital in New York City. And at that time, this was in the late 80s, you may recall that HIV was the big disease of the day. And at that point, they weren't sure what was causing this immunodeficiency. We knew it was caused by a virus. There were no cures. So there's some similarities between what we're dealing with now with the coronavirus and HIV in terms of the public's response. So everyone was concerned. They weren't sure how it was transmitted. And we've gotten past that. From our perspective, we thought that would probably be one of the biggest diseases that we had to deal with as far as public health is concerned. However, there was always this looming concern that you could have another virus being transmitted similar to the flu, which could create another potential pandemic, similar to the Spanish flu pandemic, which is always quoted, which took place in the early 1900s. So that thought always was present. But this virus itself probably represents that it may have an even greater toll in terms of the number of lives taken than the previous Spanish flu. What's fascinating about this disease is, from my perspective, is the speed at which it has changed the society, and this is globally. We have our concerns about, getting back the colleges open and sports and what have you, but this is a major historical event that we're all dealing with and we're going through, and we have to keep that in perspective. So let me bring this back a little bit to the actual virus itself, because from a public health perspective, once you have a disease that's communicable, and it's caused by a virus, that raises some concerns. Remember, there are no cures for any viruses. So this is not as if it's a bacteria in which you can take an antibiotic and that will treat the disease and kill the bacteria. No cures for any viruses, so that's a concern. Then you have a virus that's also lethal. So we're finding out that it can actually kill people once you're infected. And then we also look at the rate of transmission. So this is a fairly highly communicable disease. So, it is rapidly being transmitted from one person to another. So when you put all of these things together, you can see that there's a major reason for concern with this coronavirus, and it is continuing to spread, and it's going to, unfortunately, probably continue to spread throughout the nation. So this is a major concern of ours altogether. It turns out, I'm sure you're aware at this point, that it appears that initially it appeared that this was more deadly, which it still is, in the elderly and people with chronic diseases such as diabetes, asthma, hypertension, things of that nature. And now we're getting reports that it may be affecting young people as well by causing inflammation in the cardiovascular system and causing a number of different variety of diseases. I say all of this to preface everything I'm saying with the fact that this is still a new disease. We're still learning as we move forward, and we're going to have to be very patient in terms of how we address this, and how we move forward in the future. So it certainly is a big challenge. On the other hand, the good news is that this virus belongs to a classification called an enveloped virus. All of that means is that essentially the virus itself is fairly fragile. So that means things such as routine disinfectants, bleach and water, washing your hands with soap and water, all of these things can kill the virus when it's outside of the body. Once it gets inside the body, then it's more difficult to certainly treat. And I think that's been some of the confusion even at the national level. You can't, because the virus can be killed by Lysol or some other disinfectant, that doesn't mean you can ingest these toxic agents and it'll kill the virus. Once it gets infected in someone, then there really are no good treatments for it.
I think, and it's what I find interesting is, having been around now for 63 years, and I'm no expert on pretty much anything, but my observation is that what I think scares people also is there's such a large medical impact here, but obviously there's a large financial impact on the nation. We're also at a time in our history, I think, where, and I don't want to say this is a generational thing, but it seems like there's a large segment of the population in the United States that really just expects all the things that you said that make this such a difficult thing. They just expect it to be, and everything will just go away and we'll be fine. Mm-hmm. And I worry because I watch on TV you mentioned that this could be this envelope virus thing that maybe if we were smart, we could help control, we could help the doctors and the other medical people control. A lot of people aren't doing their share.
Right. Well, I mean, the good news, though, is if you use New York as an example, where we did engage significantly in social distancing, you can see that it has really brought the number of deaths, the case fatality rate on a daily basis, the number of hospitalizations, all of those things are really going down. So we've demonstrated that we can do this with social distancing, but now we have to balance, as you mentioned, the economy and when do we restart things and when do we begin to move forward. And that becomes the tricky part. And how do you do that? And how do you phase this thing back in without, again, causing a second wave where things can recur?
Well, that brings me to my next point. Then, this idea about that I'm sure you're going to be a big part of the discussions on the campus at New York Tech, about bringing, in our world, it's mostly about how do we bring the athletics back, but that doesn't work unless we could bring students back to the colleges and universities. The NCAA came out with a plan, not a plan, but some important points that they felt are necessary as we re-socialize sports into our campuses. What would you say in your mind for any school to be considering or getting ready to bring students back? What are some of the important things that you see that need to be addressed?
Right. Well, let me start off with the big picture. So ideally, under all ideal circumstances, what we would like this to end up being is similar to measles. So you know how in order to gain entry into a college, you have to demonstrate that you have immunity to measles. We have a blood test that we can check and see, do you have immunity, yes or no? And if no, we have an available vaccine that we can give you. And then you can come to school and you have no concerns about the virus being transmitted. And I'm sure if you ask your audience people, and even people within the medical profession, many people have not even seen a case of measles. I happened to see one when I was in circus, and that was fairly rare. So that's the way that we would like this virus to go. Here are the problems. Number one is recently they developed an antibody test so we can actually check your blood to see if you've been exposed. that test is not that great. And then the other problem is that even if you have antibodies, it's not clear that that's a reflection of immunity to be able to prevent you from, again, being infected with the disease. So we have two big challenges before we can get to the point where we're like measles and everything just moves forward as normal. So that's the biggest challenge. So having said that, all we can do really at this point is to do diagnostic testing, whereby we're actually just looking for the virus itself. So you may have heard about the nasal swabs and things of that nature. So that's the test that we're looking to make a diagnosis that a person is currently infected and in fact has a potential to transmit the disease. Again, why this is a challenge is because it's possible if we were only going to test those individuals who were sick or ill or demonstrating symptoms, we would miss roughly 25 to 30% of people who don't have any symptoms at all. So that means that we would have to really test everyone irrespective of whether or not they have symptoms and to try to make some assessment. And then we would have to go into the public health model. We test, we find that you're positive, we isolate you, and then we do the contact tracing to find out, well, who have you been in contact with who you may have infected? And then we start that round all over again of testing and so on and so forth. So that's a fairly intense program. And in fact, that's what I've been doing for New York Tech. To show you how overwhelming this disease is, when we first had a case on the campus, the routine is that you contact the local health department and they send out their contact tracing team and they do that whole piece. As I may have shared, I work with the health department here in both Nassau and in Suffolk. So I call them up to let them know, oh, you have a potential case, and I'd like them to follow up. And they sort of laughed and said, you know, Dr. Harper, we don't have the capacity to test and follow up all these individuals. And at that point, New York City had already dropped following up because nobody had that sort of manpower to follow all of these cases that were increasing so rapidly. So then that became my role to some extent now to follow up on all of these individuals. And it's a very labor-intensive sort of program to develop that. So we were fortunate that
was with one case.
One case, right.
Yeah.
So with each case, you have to find out, well, who were they in contact with? Then you have to notify those individuals. Those individuals have to be have to be quarantined. The person who's positive has to be isolated. You have to wait 14 days and see if they have any signs or symptoms, and then they're allowed to return back to campus. Because at this point, we didn't have a large number, or the test itself wasn't available, so we weren't going to test everyone at that point because we wanted to save the test for the hospital setting. So as I mentioned, that's labor intensive. Then you have to keep track, and then the person would go home. Oh, okay, well, I was a close contact of my relatives, and so on. It just one thing builds on another, and it's very time consuming. So as you're aware, at some point we decided to close the college. It was actually mandated by the governor. And despite the fact that the college was closed, we still had people working in facilities, landscaping, things of that nature, and people were becoming infected. And this was, again, very labor intensive to keep track of that. So you can imagine if everyone was going to school like just business as usual, a lot of people have been infected, a lot of people would have been isolated, and it would have been really difficult to deal with. And that's what the state government is dealing with on a broader perspective. If we just allow business as usual, a lot of people are going to be infected, and it's going to be a lot of contact tracing, and the numbers could potentially rise. So having said that, we're basically waiting for our orders from the governor as to when we can move forward and reopen schools. And based on the data and the way that data is being collected, it appears that there's two different sorts of epidemics going on. You have one upstate New York, which seems to be fairly mild, and then you have downstate New York, obviously New York City, Long Island area, where you have a more populous region, people living much more closely together, and as a result of that, the virus is being spread much more rapidly. So the truth of the matter is, if you're in a rural area, you don't come in contact with a lot of people, it decreases your risk of transmission. So that's where we're currently at. And I would assume that once we have the okay from the governor even to open, as far as sports is concerned, that may still have to be phased in, whereby you may be able to engage in sports activities, but whether or not large crowds will be allowed to congregate and to sort of be in the audience, that's still a question. So I would imagine that things would maybe televised initially, and then eventually the audiences will be able to come back.
Yeah, and I think, you know, for us in athletics, at least in Division II, you know, our concern is mostly with getting the student athletes the opportunity to start competing. Obviously, it would be nice if people could come watch their games, but the most important thing is to try to get back to normal. I guess my question would be, based on all the things that you just said, you know, I'm concerned about the labor intensiveness of this thing. You know, I read some of these suggestions about sanitizing areas of use and things like that. Obviously, schools have forever had protocols for caring for athletes and taking care of their facilities. But, you know, I'll just tell you real quick. At one point, I was an athletic director at one of the community college, Suffolk Community College. And we started, and this was during the outbreak of, what was the skin disease that was that SARS that we were dealing? No.
SARS was, again, that's a respiratory disease.
Respiratory. One of the other things that was going around, it was because of mats and things like that weren't properly cleaned. So we had to put this, we had to, you know, make sure we were doing it well. But, you know, it was very difficult to control that. You know, you would tell somebody, here's your job 4 times a day, mop these down, and you would hope that they were doing it.
Right.
You know, so I think that I worry, you know, we could have all these rules and these suggestions. I just don't know how realistic it is, and especially at a time when schools are concerned about enrollment and
Sure.
it comes back to our economy and things like that.
Yeah.
You know,
I completely agree with you, and that may have been that might have been streptococcus. There was a
okay.
disease. I don't know if that was.
I'll think of it afterwards.
Yeah.
I remember protocol.
But yeah, your point is well taken. That it's very difficult to sanitize and to maintain that. So we're looking at the same thing within some of the dormitory areas and how we would do that. And as you mentioned, that's a big problem for facilities to be able to have the manpower to continue to clean and keep places sanitized. That's going to be a challenge. And that's why each individual has to also take it upon themselves to wash their hands and use hand sanitizer and things of that nature. So
that was going to be my last question for you. Okay. Is as you again as in the position you have on the campus there as a professor of medicine, if you were being asked for advice for student athletes and parents, you know, about things that they should be focusing on as in the coming weeks to make sure I shouldn't say when we reopen and we try to start moving back to this normal period that's more normal, what are the things that they should be thinking about?
Okay, so certainly I would say even if the governor opened up the state tomorrow, I would still be wary of large crowds. Remember, you can't get infected if you don't come in contact with someone who actually has the virus. So the more you can reduce the number of people that you come in contact with, then the more you can reduce the chance of becoming infected. As I mentioned, the second piece would be to obviously do what you can to prevent the virus itself from getting into your respiratory tract. So one of the reasons why we wear masks is not necessarily that it will prevent the virus from you breathing in the virus. There are certain special masks, the N95 masks, some of the masks that we use in the hospital setting that will do that. But the routine face coverings that we use is to prevent you from spreading the virus to someone else. So if you sneeze or cough, you won't spew it all around the environment. It'll stay basically within that mask. So certainly continue to wear your mask as well. As I mentioned, if you go in any public areas, if I go to a Walmart or if I go into a supermarket, as soon as I come out, I clean my hands with my own hand sanitizer because you never know what you've come in contact with there. As soon as you walk into the house, wash your hands with routine soap and water. I mean, these are things, the practices that we're going to have to just make more and more common. It should become more and more routine for us to do that. Other than that, if you become ill or you feel ill, then certainly you would want to isolate yourself even within your own home to make sure that no one else contracts potentially not only this virus, any other virus that you may have. But we'll have to be more astute to doing that. And particularly if you have elderly people that you're living with at home who may have other diseases. I mean, for as far as an athlete is concerned, still the percentage is still fairly low that anyone will actually succumb to the disease at the point that they're in college. People may become ill, they may get sick, but fortunately, as we know now, it doesn't seem as if it's affecting the younger community as much as it's affecting the older community. Not to say that people haven't died in that age category, but it's still a little less likely.
I think, you know, and actually Dr. Zweibel earlier had, he had said something similar. And I, you know, to me, it kind of comes down to, while the New York Institute of Technology and every other college is going to do their best to provide the best experience, the best setting, to try to be as precautious as they can. A lot of this does come down to personal responsibility too.
Yeah, that's correct. That's correct. And there's no way for us to sterilize the entire environment. You know, that just cannot be done. And I always let people know that, remember, we're not just purely defenseless out here. We've been blessed with, all of us have an immune system that's really designed to help us fight off viruses. So some people, for whatever reason, their immune system may not be working as well as others, and therefore they become sick. And and that's not even that clear as to why some people become ill and some people do not. But if you recall, there were a number of athletes. I remember looking at some NBA program, and where they found out that they were infected, and they said, "Boy, I didn't even know I was infected. I'm ready to go to a 7-game series right now." And to me, that's the ideal. That's the ideal situation. We really want to strengthen our bodies as much as we can so that when we come in contact, not only with this virus, but other viruses, that we have the ability to fight these things off. So all of the routine recommendations, because remember, I'm into preventive medicine. So all of the routine things that we say about eating healthy, exercise, keeping your weight down, all of those things now would come in very handy if in fact you did come in contact with the virus, because your body is just that much stronger to be able to deal with this virus and or any other virus.
Well, you know, I think that in your situation there, in ours, dealing with, well, what will the future bring? A lot of the things that we hear are, unfortunately, on a daily basis, there's a lot of questions, a lot of negative. But I would love for you, as we close off, for you to give us a positive perspective on where you think even from a long-term perspective, where do you think we're going to be with this? Okay,
again, from a positive perspective, I feel comfortable that, remember, there's been no virus that has just come and just entirely wiped out the human race. So
that's positive. Good. Okay.
We can start with that. And generally speaking, viruses and organisms, the most deadly organisms will infect a person and kill them right away. And that's not good for the organism itself. So if I were infected with a virus and it kills me right away, it doesn't give the virus an opportunity to sort of replicate and continue to infect others. So what happens over time is that the least virulent viruses, or the ones that are not going to kill you, those are the ones that tend to survive, such that both populations can continue to thrive without having a problem. So I think that eventually that's what's going to happen with this virus. People will develop immunity. Some people, unfortunately, may succumb to the disease, but at some point we'll come to an equilibrium whereby we just continue to move forward. And remember, that's how the common cold works. The reason why the common cold has been around for so long is that it makes sure it doesn't kill the host. It just gives you a cold, it continues to replicate, and it moves on and infects someone else. And that would be the best case scenario with this virus.
Well, we're looking forward to it getting better, and we hope that maybe we could touch base with you down the line a little bit and get an update from you what you're seeing, because this is I find this stuff fascinating and it's challenging, and we're just crossing our fingers that things get better soon, and you know, working together to try to make it better.
Absolutely, I'll be happy to come back. Just let me know.
Well, I want to thank Dr. Brian Harper from New York Institute of Technology for spending a few minutes with us today. This was ECC Timeout Talks. Bob Dranoff, thank you very much. We'll see you next time.
Okay, thank you.